Hey there everyone, Tom with Move Ed. Today we're talking about low back pain, more specifically screening for red flags. So before we begin, a quick disclaimer, this presentation does not constitute medical advice and the contents of this presentation is more specific to early career or junior private musculoskeletal clinicians. The other thing to mention just before we move on is we are talking about less common but clinically important causes of low back pain. So this is not stuff that you'll be seeing commonly, but my personal opinion and something I think is reflected in the more skilled clinicians that I work with is that they know the rare or less common things really well, so that when they're treating people, they can be confident that one, they're not dealing with one of these problems, and two, that if they do find something, they can detect it and then refer on appropriately. And touching on that a little bit more, I think it's important to know what you're actually looking for when you're asking for red flag questions or screening for them in the clinic. People are really good at asking, do you have any bowel or bladder symptoms? Do you have any saddle anesthesia? Have you had any recent weight loss, night sweats, etc.? But the next step clinically is actually pairing those findings with what you would expect in certain red flag conditions. And actually knowing what answers from a patient is concerning and what things that they might respond to you with it aren't as concerning or aren't as worrisome. So the key conditions that we're thinking about when we're screening for red flags are one, infection, and the key things that come to mind here are spondylodiscitis, so infection of the vertebrae and the disc, and epidural abscess is another complication of procedures that can develop as well. Cauda equina syndrome is the big ticket item here that most people are quite familiar with. Cancers is unfortunately quite a common cause of back pain, particularly in the older population, and it's predominantly metastatic disease that you're dealing with. So breast, lung make up the key primaries that will metastasize to bone of the lower back, but prostate, renal, gastrointestinal tract, and thyroid are possibilities as well. Primary malignancies, multiple myeloma, lymphoma, and sarcoma are examples, but there are others as well. Traumatic and atraumatic fractures are important pathologies not to miss. And then autoimmune diseases may not necessarily constitute a true red flag, but it's something that you should be on the lookout for and something that you don't want to misdiagnose. So thinking about the key features of each of these red flag conditions is a relatively lengthy table here, and I'd encourage you to pause it and have a read through. But it's good to think about what risk factors might people have that would make something more likely or be more concerned that they're presenting with this problem. And a good example would be of the spinal infections. People with a history of intravenous drug use are far higher risk for spondylodiscitis or epidural abscess. Same with chronic alcohol dependence. Recent invasive procedures, including an epidural injection, is a risk factor as well. And then recent infections have the possibility of seeding or spreading to the lower back or other bodily structures. The key signs and symptoms are listed on the right-hand side of the table. Yet again, I'll encourage you to have a read through in some more detail and familiarize yourself with the key risk factors that might lead you to think that someone has one of these conditions, and then the actual signs and symptoms that you would expect, so that you can be confident that when you're asking questions about, say, saddle anesthesia, in cauda equina, what are you expecting them to say if they have cauda equina? Same with bowel or bladder symptoms. With cauda equina as an example, you're expecting a pattern of urinary retention, progressing then to fecal incontinence. So if someone says that they're having some dribbling when they cough or sneeze, you're confident that's not the cauda equina pattern of urinary symptoms, for example. Yet again, have a pause, have a read through and familiarize yourself with the content of this table. To summarize, there's a helpful mnemonic called tuna fish when it comes to low back pain red flags. So tuna fish stands for trauma, unexplained weight loss, neurologic symptoms and night pain. And neurologic symptoms more specifically, I would say, is expanding sensory change, any motor involvement, or saddle anesthesia or involvement of the bowel bladder as explained previously. Either extreme of the age spectrum, and then fever, intravenous drug use, steroid use, and a history of cancer as previously mentioned. Thanks everyone.